I guess it all started, I never had a weight problem growing up. I did
Mhm.
grow up in a very obese family. I have 10 brothers and sisters, and 8 out of the 10 are obese.
What kind of sources were you getting, for what you tried?
I basically primary care. It wasn't taboo. I just was so desperate to get it done. And I just kept getting the same thing.
So welcome to another episode of Beyond the Scale with Dr. Minera. And today I am incredibly fortunate, blessed, and very, very happy to have with us Miss Ida Thornton. She is a patient, friend, and what I consider, I think I told her this off camera before, what I consider to be a huge, huge success story when it comes to her journey with her weight loss and how we have arrived where we are today. So I want to thank you for being here.
Thank you for having me.
I think this is awesome. One of my objectives is to make sure that we have information out there for patients, information for those who haven't taken the step. And I think that having the ability and being blessed to be able to interview or I would say, have as a guest on my podcast, someone as gracious as you and also as knowledgeable in, what it entails to be a patient, and having been on that side is so valuable, for my patients. So again, thanks for being here.
Thank you.
And Miss Ida Thornton, so a little bit of a history on her. Owner for 29 years this year of a medical billing company, and recently has sold it, and she is a new retiree. And that's another topic of conversation where we're going to adjust her new reality. But Ida had joined my practice and come to see me back in 2022 as part of her weight loss journey as well. And so I wanted to, just for the audience, kind of get a feel for, where your journey started, taking us back to, and again, this could be something that, our patients relate to, when you started to notice, your struggles and, where it brought you to in the different steps, that where you have arrived today. So.
Sure.
Yeah.
I guess it all started, I never had a weight problem growing up. I did grow up in a very obese family. I have 10 brothers and sisters, and 8 out of the 10 are obese.
Oh, wow.
My father is obese. My mother was not until her 7th child.
Yeah.
So, we grew up
God bless your mom.
Yeah.
Yeah.
She's a wonderful woman.
Yeah.
I had to have a hysterectomy when I was 30 for a medical condition. And so I lost an ovary, a uterus, and that's when I started having a problem. Was that everything had changed. My whole metabolic system, I felt like, had changed for me. And slowly the pounds crept on. I'd had 2 children by the time I was 25. And the first child I had, all my weight went right back off. The second child, he was over, I gained like 65 pounds. I couldn't get that off. I slowly, got like 30 of the 60. So I was an extra 30 pounds heavier before I even had the hysterectomy. But after that, I just gained and nothing seemed to work. I tried every fad there was. I tried Weight Watchers. I tried phentermine, the fen back then, before they took that off the market.
Absolutely.
I tried that. I tried the Atkins diet. I think I tried everything.
Yeah.
I had success for a little bit, but as soon as I stopped, I went right back and more. I'd gained more and more. And it was increasingly getting harder to exercise. I tried to swim. I tried to hike, tried to keep up with my kids. Everything. And it just didn't work.
It's incredible how, we talked a little bit about everybody has a unique, story, a unique journey, struggle with their weight. But a lot of the factors that you mentioned are so, so common, especially there usually is a certain time when a patient starts to struggle. What's interesting is that, you do have that family history, and that's very important. The genetic component is huge,
Yes.
but it didn't affect you until, you were 30. And then, again, looking at those, that surgery, looking at those, other things. I like, obviously that you had also, attempted what we call, on your own to try to combat this. You did the Weight Watchers, you did the Atkins, different things like that. Now, were you guided by, any type of, medical advice or help, or were these like, okay, you know what? People were commenting, everybody was giving me advice, yeah, I heard it, on TV, so what kind of sources were you getting, for what you tried?
I basically primary care. At that point, they're like, you have to lose this weight. You're skyrocketing. At that point in my life, I was about 180 pounds, which was still way heavy for me. I'm only 5'1".
Right.
So that was super heavy for me. I started having joint problems and stuff. So I'd go to the primary care. I said, please help me. I'm trying this. I'm doing this. And he's like, oh, you just got to try harder. You just got to try harder. And I try harder. I didn't want to be that way, but it seemed like every step forward I took, I went back twice, if not even further than that. And so mentally, it really affected how I saw myself and my worth. And I felt like, oh, this is never going to work. I'm doomed because I have an obese family, and I believe in heredity to some degree with weight loss and with weight issues. So I started really feeling down about myself. Excuse me. And then I just kept trying and trying. And at that point, I was well over 200 pounds. By the time 2007 came around, I was looking into a lot of the weight loss surgeries. Mm-hmm. I was that desperate because I was trying so hard and nothing was working. Mm-hmm. And the more I didn't want to eat, the more I ate.
Right.
And the more I wanted to exercise, the less I did, because it hurt. It was a struggle. I kept feeling like I couldn't do it.
Yeah.
And although I had a very, very supportive family, very supportive husband, children were very supportive, I just felt like I wasn't good enough to do it on my own.
Yeah.
And at that point, I decided to do gastric bypass when that first came out. And I did, and I was successful for about 3 years. Mm-hmm. And then it just started creeping back on. Life got in the way. I ran my business, and that took a lot of the stress of, running a business to realize that I didn't have time for myself, to really focus on myself and really focus on the weight loss journey. And I loved that I got back down to a size 12, and then I got back down to 170 pounds was the lowest I went.
Uh-huh.
After
the surgery.
After the surgery. But I was at a size 24 when I started the surgery, and I went down to size 12.
Right.
Okay. So it's not just about the weight itself. It was about how I felt and how I felt about myself. And so I enjoyed that pleasure for almost 3 solid years before real menopause hit. My last surgery was I had to have the last ovary out, and then I didn't have any hormones.
Yeah.
And so that started a whole new cycle for me. And by the time I came to see you, Dr. Minera, I was 246 pounds. And so from 2007 to 2022, it just kept climbing and climbing. Mm-hmm. And I went back to the bariatric surgeon and begged him to help me get this off. And he basically just said, it's on you. You have to do it. Mm-hmm. You have to do it. And so that really discouraged me. But I kept trying. I joined the gym. I did the swimming. I did everything that I could possibly do in my mind when I wasn't successful. And then I saw my daughter, who had gained a lot of weight, having 4 children. And she found you. And I don't know how she found you, but I am so thankful she found you. And I saw her success. And I said, please tell me how you're doing this. And so she explained to me what your company was about and what you do for your patients. And I'm like, I have to do this. My knee was bad. The doctor would not do surgery on me because my BMI was so high. And so he said, Ida, if you really want your knee done, you've got to lose this weight. And at that time, Erica was coming to you as well. And so I said, okay, I got to do this because I can't walk. I've got to do this.
Yeah.
And that's when I found you.
That's fantastic. That's so cool. You know, and it's really interesting because, you know, as physicians, I mean, we know why we're doing what we're doing and we feel, you know, very, you know, comfortable with all the steps, but, you know, finding out, you know, and kind of like validating how I'm pretty sure a lot of people are feeling out there. You know, you said something incredibly key, which I think is so important to really kind of like re-emphasize, is you didn't want to be that way, you know? And it's so easy sometimes, you know, when we see someone, you know, in whatever situation that we assume is, you know, of their making their choice, they want to be there. You know, so many patients have already been judged and have been told, well, if only you, then this. And you know, so I feel that that's very important to highlight, is that, you know, nobody wants to be, you know, everybody, I assume most people, you know, in the right mind want to be at their best, you know? So, I mean, it's very frustrating when you're trying, you're attempting. Another thing, you know, just kind of like taking from your, you know, your experience from when, hey, I didn't want to be like this, but I was struggling and I was doing this and this and this. And then I decided to research, you know, doing gastric bypass or bariatric, you know, metabolic surgery. You had mentioned it to your primary care, but what kind of guidance did you have, Ida? Or was it more like, okay, you know, I'm advocating for myself. I'm navigating kind of like, you know, blindly here, but this is my desperation point. What guidance did you have then? And, you know, where are we today, in your opinion, with, you know, the ability for a patient to find guidance or, you know, some kind of hope?
Well, you know, I think I did a lot of research on my own because there really wasn't much out there other than this is the cure all, basically. And I kept seeing that, oh yes, this is going to be perfect for you. And at the time, gastric bypass was a big deal and it's a big surgery. And if you understand an overweight patient, one that's tried everything, you will try anything to make it happen. And although they said, you know, there's a lot of risk involved at the time because everything it's changed now. They've got, you know, the sleeve, they've got so many other things now, but at the time that was the biggest risk. And my doctors were like, you know, you have to be committed. And I felt like I was committed all this way to that point, but nothing was working. And so I said, I'm committed. Let's do this. I didn't really, they take you in for an hour's worth of mental health overview to make sure that you can mentally handle having a teaspoon of food. As you know, food noise is a major issue. Yeah. And when you love food, I'm pure Italian, you know, I love food. Yeah. Yeah. Give me that pasta, you know. Yeah.
And it's cultural too. I mean, a lot of, you know, you know, not to cut you off, but I mean, a lot of what we do, you know, in different cultures is, you know, is around food.
It's around food.
We celebrate around food. We mourn around food. We, you know, everything around food. So it is a huge,
it's a big thing.
It's a big thing.
But I had one provider, and she was a nurse with one of the bariatric providers that I've known a lot of providers over the years with a business that I have done with medical billing, but she really was encouraging and says, you know, Ida, if nothing's working, try it. What do you have to lose other than weight? You're going to lose weight as long as you do what we're telling you to do. And that is true. I did. I lost very fast in the beginning, like 50 pounds within like 3 months.
Wow.
So that was a lot.
It is.
Almost too much. Because you can only eat so much and so little and drink so little. And I kept thinking to myself, is this going to be good for me? and it was a struggle. I'll tell you, the first month was really a struggle. I would smell pizza and all I'd want to do is eat pizza.
Mm-hmm.
And at one point I would cry and say, I want that pizza. And what I would do, I'd take a bite and chew it and spit it out. And I tasted it. All I wanted to do was taste it.
Mm-hmm.
But that's the kind of noise that you get in your head. You know what I mean? Because you know what it tastes like. It's not, it's not good to do something like that. But I mean, that's where I was. The first month was a real struggle.
Mm-hmm.
And then it got easier because then, I knew what I needed to do. But as far as guidance, I think that once you do it, you're on your own at that point because it's going to be up to you. It's going to be up to who you're with, your family to support you. And I had a lot of support, but it still was hard.
Yeah.
It still was really difficult to keep that. And as I started gaining the weight over the years, I would go to my primary care, anybody that I could talk to, do any research that I could talk to other patients about, how they, did they keep it off? I had a nurse friend who had the gastric bypass, and then she ended up having a body lift because she had lost so much weight.
Mm-hmm.
But then she gained it back because there was no help afterwards.
Yeah.
There was no follow through. You go a year later, a year could change your whole world again, as far as weight loss and gaining and stuff. So I felt like I really didn't have all that, and it just creeped on you slowly.
Yeah.
And so I didn't really have much to fall back on other than myself.
Yeah.
Which was unfortunate.
And I think that's, the point that is important that we're making here is that there is so much chatter, so much noise out there, so many opinions, so many ideas, suggestions, that are coming from all different angles. That people are very confused and very overwhelmed. And so, they eat this way, don't eat this way, cut these out, don't cut these out, and so people just, and when they come and see me, for the first time, a lot of times they're like, you know what, Dr. Minera, I am so confused. Really what I'm looking for is just a little bit of, of order here, some information to tell me, what is right. And unfortunately, that's hard to, kind of say because what's right for one person isn't necessarily right for the other. And I think that we've come a very long way. And one of the points, also that I'd like to highlight is that there is bariatric metabolic surgery is definitely an incredible, important tool that we use as physicians. Mm-hmm. But the point being, it is only a tool. It's not a cure-all. It's not it's not the last recourse. It is a tool that we evaluate, by individual factors and situations. And because you've taken care of the metabolic surgical component, doesn't mean that we don't continue to address the other issues that are ongoing. Where's why, we had so much success with you. It's because, finally you were given permission to say, listen, your surgery didn't fail. Your surgery did what it was supposed to do. I think where, we've grown a lot is in information and the ability to continue to manage this as a chronic long-term medical condition that it is. Absolutely. And I think that's the paradigm shift that we need. Yes. And fortunately we're arriving at. I want to know how you felt. That's important to me too, because your journey is one thing. How did you feel throughout this journey? How did you feel? Obviously you've alluded a little bit to it about yourself. How did you feel about other people? You mentioned your family was very supportive, but did you ever feel judgment? Did you ever feel, was it acceptance? I commend, the nurse that, spoke to you and was able to help you, get your surgery. Empathy is an important thing. Patients are very vulnerable when they come in for many reasons, but a lot of it has to do with their prior experience before they come in and see us and have a different type of conversation, which again, I am very blessed to be in an era where, I am specialized and I know, what maybe what patients are coming for, but tell me a little bit about that, and maybe the disinformation, or the lack of empathy, or, how you felt on the streets, or, did you travel a lot? Was there anything, airplanes, tight spaces? Give me a little bit about how you felt there.
All of that. After the surgery and after I started gaining the weight back, I felt very insecure, even though I had to be in front of people all the time. You have staff and you have providers and you have meetings and groups, and little by little, I'd start to shy away from that because I got bigger and bigger, and I kept feeling like I wasn't good enough. Even though I deep down knew I was trying everything I possibly could. I felt like a failure a lot of the time, especially in dealing with people on a day-to-day basis, and having them see me. I guess what I always would try to do would always, dress up and make sure my hair was nice and everything, because I felt better about myself that way, but I wanted them to see me for me. And a lot of the times all I could see was the big me. And I didn't want to be that way. And so I never felt really depressed or down about it, but deep inside, I wanted them to see me like they were seeing another person that was 100 pounds. You know what I mean? Mm-hmm. So in my mind, I kept saying, okay, one day they're going to see me this way. One day, and that day wasn't coming. And so I was like, what do I do? What do I do? And that's when, my daughter started to struggle. And when she mentioned you to me, I knew I had to do it. I just knew it. It scared me to death knowing I had to come to you and tell you that, yes, I'm 246 pounds and I like to eat pasta all the time and those kinds of things. But I said, if I don't do this now, as I get older, and I wanted to set an example for my grandchildren. They're all very active and beautiful children. And I didn't want them to not enjoy me. I couldn't go on hikes. I couldn't do a lot of the things that they were all doing, and that really, really upset me.
Yeah.
And, of course, when I had to have my knee surgery, that, thank you, Dr. Nielsen, for saying to me, I love you. I want you to have this surgery, but I can't treat you until your BMI is at least whatever number it was.
Right.
He said, and I will do anything I can to help you do that. And so that was an eye opener for me.
Yeah.
So I'm like, yeah, my BMI is high, isn't it? You don't really think of those kinds of things like as a provider would think. Mm-hmm. You just think of, how you look, right, and how you feel.
Right.
So that was a real eye opener. And then when I started with you, I felt like I can do it because you made me feel that way. Makes me want to cry.
Oh, that's sweet. And I really appreciate that, and that's something that, we try to, always emphasize is that connection, with your patients and, and grace, showing your patients grace and, because that allows them to start the healing process of showing themselves a little grace as well.
Yep, and that's exactly what you guys did.
Yeah.
And I felt encouraged. And I think that you gave me a reason to feel like this was going to work, and then I also had more faith in myself too. So,
and people don't realize that, your biggest judge is yourself,
That's so
and
true.
So they don't need, you don't need somebody on top of already how you are judging yourself to be a second, negative judge on you. Which brings me to a question which is probably a little bit controversial, but, I will preface it by saying that there is data in the literature, that we look at, through our board certification process that states that in this day and age, still one of the acceptable means or forms of discrimination is to discriminate against overweight and obese people. Society still sees it as something, not as terrible as discriminating, because of your cultural background, because of the color of your skin, because of your, language, or, whatever other things, that we use, as sounding boards against discrimination. But it's very, very hard to find somebody who will, accept the fact that being overweight and being obese does actually expose you to discrimination.
Yes.
Did you feel there was a difference in how you were treated? And again, I mean, this may be something that did happen or didn't happen, but did you feel, out in the grocery store, when you were shopping for, clothing, even in, the boardroom, in your company, in your business, was there a difference between how they treated, 240-pound Ida versus how they treated, 170, 160-pound Ida? Did you perceive that?
Absolutely 100%, which is unfortunate. And I perceived that not only in my personal life, I perceived it in my professional life. And, some it's really hard to explain, but some of the practices that I worked with were very opposed to hiring people that were bigger. They didn't have the space. They didn't have the accommodations at the time. I felt that with one company that, I ended up not and choosing to do business with, because I felt how they were treating people that were obese. I mean, I couldn't just sit at a normal chair. I had to have a bigger chair. Same way on an airplane. You were talking about that. You had to get an extra belt. You know what I mean? How embarrassing is that? I'll never forget the day that I got on an airplane for the first time after losing weight and put that seatbelt on, and it fit, and I didn't have to ask for that extension. Wow. That's a success to me.
That's a major victory.
Yeah,
it's amazing. Yeah.
Yeah. Or you're at the beach and you're sitting there in your bathing suit, which is very hard to do. And, you've got everybody else, normal weight and bikini clad. And I mean, inside you're feeling like, I don't even want to get out of this chair. You know what I mean? I just want to sit here with my towel wrapped around my legs, and people watch and they look and they make fun of. And I feel for the children these days, that child obesity is so prevalent, and how scared they are that their peers are going to say something to them. I've seen it happen. Yeah. And it's very, very sad. But you do feel that discrimination, unfortunately.
It's very unfortunate because, again, other data and statistics, that are out there talk about also, you mentioned it, discrimination, even in the workplace, perception of, whether you are a hard worker or lazy. I hate to say it,
exactly,
but it all goes in, unfortunately, sometimes through the eyes. And even though we may not be consciously thinking about it, we do find, and again, that a lot of the better jobs, a lot of the high end, opportunities and whatnot, are, out of reach for a lot of people, unfortunately, by the way, just that they look, because a lot of assumptions are made.
That's true too. And even the assumption of, say you're at a party and you grab a chip or you grab something and you hear a snicker behind you saying, oh, no wonder why she's 240 pounds, because she just ate potato chips. Well, that's a normal thing to do at a party. If you're at a barbecue or something, you're going to eat a chip or whatever. You almost feel so guilty even eating in front of people, because they're judging you from what you're eating. You should be having salads. You should, just have that chicken over there that's no skin on it kind of thing. That's how your thought process works. And so it's very hard to be in front of people that, don't love you for you. And you first have to find that you have to love yourself enough to make this happen.
Right.
And that's really hard to do when you're not feeling like you love yourself or that no one else does. You know what I mean?
Absolutely.
So it's really hard to get past that. But
yeah,
I would say that the discrimination is really, really tough thing to get through.
How difficult was it to open or start a conversation, even with a medical professional, when you, for instance, were starting, your journey and you had to speak to maybe a primary care doctor? I mean, was it, a topic that was taboo to you? How did you feel with opening up that?
it wasn't taboo. I just was so desperate to get it done. And I just kept getting the same thing. Here's 1,200 calorie diet. Follow that. You'll be good.
Yeah.
And that's basically all I ever got, unfortunately, until these past several years where this started to become such an epidemic of weight and especially in our children, that they started changing the paradigm of people really wanting to know really how your metabolic system works so that, you know, even though you're trying, that maybe there's a better way, and you found a better way. I mean, you've studied this, you know exactly what your patients are going through. You've probably seen a million different IDAs and different.
You're unique.
You know?
I'm sorry.
you know, I'm just saying that, you know, we all are struggling. That's why we were here with you, is that each one of us had a different way of struggling. And I feel like if we had more providers that really truly understood how this was really affecting people, that, you know, the world would change with weight loss. It really would. And you made that change. You made that difference for me. You made that difference for my daughter and for a lot of people. So bless you.
Oh, you're too sweet. So, you know, we talked a little bit about, you know, how you had felt, obviously, you know, how you were treated, you know, how people perceived you. I guess I'm going to turn, you know, the question on you. You know, now that you're in a different situation, you know, mind you, you have had that struggle, you came through, you know, the journey. You have a different perspective of what it is to struggle with your weight, of what it is to, you know, be understood, etc. When you are out and about and you are, you know, when you see different, you know, people out there and they are overweight or they are, you know, what we would consider to be obese, what is your reaction to them now that you're in a different place, at least, you know, from a physical and even mental, emotional, you know, spiritual standpoint? You know, what is your thought process towards somebody who is struggling?
Well, first of all, I look at them and I think to myself, you know what? They're a person just like me, and I will treat them the way I want to be treated. And so that's my first and foremost thought, is that how important it is for someone to have some kind of positive reinforcement to anyone who's going through that. Mm-hmm. I don't care if it's like, oh, I love your dress, you know, even though, you know, she may be 300 pounds, something positive about what they look like. To me, I try always to make sure that I say something to someone. Mm-hmm. I don't care if I'm at the grocery store, you know what I mean? Or, you know, anywhere or in a meeting or whatever, because I know how they feel. You know, they're trying to look their best, even though, you know, people are seeing them in a totally different way. Yeah. So positive reinforcement is key for me to anyone. I don't care if they're a stranger or not, mm-hmm. Because I would have loved for someone to say that to me. Yeah. You know, so. Yeah,
I think that's important. And also, you know, being sincere, you know, a sincere, and I love that, you know, so it's more about, oh, you know, I love your dress, you know, and just a kind comment, because you're absolutely right. I mean, you are already, you know, very self-conscious. Yes. And I guess, you know, what it provides for you is the ability to empathize with that person, to understand that their, you know, their struggle is understood. And again, you know, it's you don't have to tell them that they are overweight. They already know it, you know. So yeah, a little bit of grace, I think, you know, and understanding. You spoke about meeting a provider that has, you know, training in this, and I think that that's very important. You know, again, because we can't, you know, I can't fault necessarily somebody who doesn't completely understand. Sure. You know, everything that there is to understand with, you know, being overweight and obesity. I mean, if there's a board certifying entity for this condition, it means that it's much more involved than eat less and exercise more. But what has been maybe your take home bullet points or whatnot of your journey in finding a provider, somebody who you would vet as, maybe qualified to have a conversation with patients who are looking for help?
Yeah, so I would say the biggest thing is that one size doesn't fit all. And so knowing that you took my whole picture, say, you took everything that I had told you of my struggle and what I've done and where I've been, and took that and tailored it to me, not to, 50 other people that are kind of sort of like me. You tailored it to myself. And I felt like you really heard me. And I think that was like the light bulb that went off in my head, that somebody actually heard what I was saying, that struggle was real and that they were going to help me find a solution no matter what. And then you tweaked it. And then you said, okay, well, this isn't working, but this is. And I knew that I had to do a lot of the work, most all of the work. You can only tell me to do so much, and it's all going to come from myself. Excuse me, I guess I'm in my eye. But to have you know that, okay, I struggled with PCOS for so long. I was diagnosed right after having, surgery. And to know that, okay, well, then maybe we have to do something a little bit different with you. Maybe, in the beginning, I wasn't on any medication. And I still managed to lose because of the training that you have to move people forward and to always be kind and considerate and never put you down, basically. And to say, okay, well, this doesn't work, so let's try something different. That really was a key for me. It's like, yay, I don't have to say, okay, this isn't working. Then I didn't get it in my head that I couldn't do it anymore, because you were giving me the opportunity to try again and try again and try again.
Yeah.
And
what I liked, and one of the main reasons, also, I was very happy, that you accepted, to come have a conversation with me, is because, you are a kind soul. You have a lot of empathy. I think that you understand, the struggle, and you also, can feel compassion for those people who are going through the same struggle, but also realize that it's much more complex than just, again, an easy fix.
Yes.
And nothing's an easy fix. And let's not even say, or assume that surgery is an easy. It is not. It's very complicated. But it's a tool. It's only a tool. And I think that, when people realize that it's much more complex than, we give it credit for, then they'll be willing to, seek out a little bit more, knowledge, take a little bit, of that monkey off of their back too, because it's just a lot to put on yourself. And it really doesn't help you. It just defeats you even more. So I think that that's, one of the main and important points, that you have been there. You've gone through the struggle. You've gone through the surgery. You've gone through the regain of weight. And all the, again, kind of like the looks and the discrimination and, the beating yourself up that entails, and then still being able to pull yourself up and say, well, you know what? I deserve to give myself another chance. And if I don't deserve to give myself a chance, or at least that's not your, your first thought process, you can say, well, my grandchildren deserve to have a grandmother for longer, so for whatever reason, whatever your why is, you have to find that and build up that courage. But I really hope that people will find, a provider who is willing to listen to them, because again, you're in such a vulnerable position. Well,
I'd like to say is that what really made it work for me with you was that I could be honest with you. And that sometimes is really hard when you're dealing with a provider who doesn't really understand. You made me feel so safe that I could say, Dr. Minera, I ate 4 pieces of pizza today, and I felt like you weren't judging me to say, oh, you're never going to be successful. You know what I mean? You weren't like that. You say, okay, Ida, so you did that and that's in the past. So let's keep moving forward.
Yeah.
And I felt like I could come in there and tell you anything that I have done that I knew was wrong. but it made me want to do better. It really did. It gave me that extra push to say, okay, I know I ate that pizza today, but I'm not going to do that again, and you would encourage. And so the encouragement alone was key for me. Mm-hmm. Just knowing that, okay, I can fail a little bit, but I can move forward. And I know that I can be successful because you're telling me I can, and and you have the tool to teach me. So it really was why I succeeded, was because of how you treated me, basically.
I really appreciate that. And like I said, I mean, I'm hoping that when people hear this, this conversation that you and I have had, they'll be willing to, to get comfortable with being uncomfortable. Yes. And having that conversation, but making sure that they're, opening up to somebody, hopefully who has, some of the training or has some of the experience. And that's very important. People don't have to go through this alone. They can reach out for appropriate help and realize that there are a lot of tools out there, to help them out. Yeah. And I think that that's, again, one of the main, takeaways here is that we can do it. You can find balance. Life goes on. Nothing has to be extreme. My favorite saying, progress, not perfection. Yeah. And you'll have different seasons in your life, where you struggle and other seasons where you don't. But at the end of the day, you owe it to yourself to be able to have that honest, open conversation with somebody to help you out.
And don't wait.
Don't wait.
Waited because I was scared, and I think that's my biggest regret, is not doing it sooner. Mm-hmm. Because I was scared. I was like, I don't want to go talk to somebody again. You know what I mean? Yeah. But don't wait. Yeah. Because time flies. Time does not stand still for anyone.
It does not. It does not. And I really want to thank you so much, for taking the time, and taking a vested, interest in, paying it forward, because that's what you're doing here. Yeah. For patients who, feel that they, are on this journey or in the struggle alone, I hope that they can, identify with a lot of the things that you've said. Again, it's very easy for me as a specialist in this area to talk about, all the different aspects and points, but it's not the same coming from somebody who, is perceived to not have had that struggle to somebody that we know for a fact has had that struggle and has gone through all the different, phases and seasons of this journey and has arrived at such a good place, in all aspects. So thanks for sharing your story.
Thanks for having me.
And I'm pretty sure, a lot of, maybe a lot of questions, there'll probably be a lot of requests, to have
Absolutely.
You back and just continue to have this conversation.
And I would love to answer or help anybody I can, because I know what it's like, and I want everybody to feel this way.
Thank you. Thank you so much, Ida.
Thank you.
And thank you, everybody, for tuning in today. And we can't wait to have another guest and have another honest conversation here on our Beyond the Scale with Dr. Minera. Thank you so much. Before we wrap up, I want to remind you that this podcast is for educational and informational purposes only. While we talk about health, weight loss, and wellness, this is not a substitute for professional medical advice, diagnosis, or treatment. Nothing in this podcast creates a doctor-patient relationship, and any health decisions should be made with the guidance of qualified healthcare providers. If you have medical concerns, I strongly encourage you to consult with a professional before making any changes to your health routine. The insights shared in this podcast, whether for me or my guests, are meant to educate and empower you, and they should never replace personalized medical care. Always seek professional guidance when it comes to your health. Thank you for tuning in, and we'll see you in the next episode.